The biggest vaccine is that it is a resource-intensive process. Any personalized vaccine, whether it's a peptide vaccine, an RNA vaccine, a cell therapy vaccine, a CAR vaccine, or a CAR treatment, anything that's personalized, it's going to take longer. And even though we met our feasibility criteria, we did lose one patient where we generated the vaccine, but the patient progressed before we could administer the vaccine, unfortunately. So although personalization is great because every person has a different mutanome, and that's well established, the next frontier really ought to be finding shared neoantigens so we could have ideally off-the-shelf vaccines, and there's no lag between enrolling the patients and treating the patients. So that would be a great next step. Then we also need to tweak our prediction algorithms, because clearly we are trying to target CD8 T cells, but eliciting a broader CD4 response. So we need to tweak our algorithms further and make them more accurate and find ways to maybe validate the top candidates before vaccinating the patients with the neoantigens. And third, as complicated as a disease as a cancer is, it's really hard to get durable responses with monotherapy. So we really have to find the best combinations for each patient and each disease setting. And that would hopefully take us where we want to get.